especially in India, the cancer in young women are rising. So breast cancer in young means women when they are affected less than 40 years of age, we call it as breast cancer in young. When compared to Western countries, the younger population is affected more in India. To say it exactly, more than 50% of the women are of less than 50 years of age who are affected by breast cancer, and more than 25% are of less than 40 years of age in India. But it is when you compare to Western population, it is a decade earlier in India.
Why is that?
So it could be probably due to lifestyle factors such as the planning their children late. Again, the lifestyle factors, obesity, like not doing regular exercises, increasing stress levels.
I see. All this play a role.
Yeah.
Can we talk a little bit about delaying the pregnancy? We have many people in the podcast, supporting and also saying, okay, this is some risk factors.
So this is one of the risk factor, but it also the woman's life also has to be taken into account. Not everyone can plan the pregnancy earlier. So if possible, it is better to have your first child before the age of 30 years. That can reduce the risk of breast cancer.
So if you have a child before the age of 30 years, it reduces the risk of breast cancer. Because why is that?
The same thing. We are cutting down the unopposed estrogen. There is pregnancy is a progesterone rich status, one thing. And when you breastfeed the children, the breast cells undergo complete maturity before the age of 30 years. That reduces the risk of breast cancer.
Okay. So early pregnancy, breastfeeding, all this make sure that the cellularity at the molecular level gets matured. Yeah. So it doesn't get multiplied into some precancerous cells undergoing mutation. I see. Okay. So I'm just summarizing what you said. So there are two hormones, estrogen and progesterone. Okay, progesterone is actually better to prevent breast cancer. And during pregnancy, progesterone is high. During breastfeeding, progesterone is still there. Yeah. So even though estrogen is there is still progesterone. So that is why you keep mentioning the word unopposed. Yeah. Unopposed is when estrogen is there, but when there is no progesterone, that is where the problem is.
Yeah.
In your practice, what is the youngest age that you have seen breast cancer?
I've seen a woman with breast cancer at 26 years. She has just completed her pregnancy. And there is also a separate thing which is very rare, pregnancy-associated breast cancer. So even during pregnancy and within first year of delivery, if you develop breast cancer, it is called pregnancy-associated breast cancer. Wow. That is there.
Wow. How do people come to you? How do people notice that there are some changes?
The most common symptom of breast cancer is a lump in the breast. That is painless lump in the breast. That is the most common symptom. The other changes are nipple changes, such as nipple ulceration, inward pulling of the nipple discharge, especially when it is spontaneous without squeezing the nipple and it is blood stain. If it is from one side, which is persistent, so that can all be a sign of breast cancer.
You're giving beautiful points. I'm just going to dissect that a little bit more. Okay. So discharge from the nipple, and it could be bloody.
Yeah.
It could be bloody.
There could be various types of discharge from the nipple. It could be white in color, green in color, yellowish, pus-like discharge can be there in infection, and blood stain discharge. So of this, white discharge and brownish, greenish discharge, they are all can be normal. But blood stain discharge or a clear fluid coming out, that could be a sign of underlying pathology. And when the discharge is coming spontaneously without even squeezing the nipple, that raises more alarm than when it comes by pressing the nipple.